Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Second line drugs in polycystic ovarian disease are gonadotropin.
Second line drugs for polycystic ovarian disease, especially for infertility.
Second line drugs in polycystic ovarian disease are gonadotropins or human menopausal gonadotropin. Human menopausal gonadotropin has follicle stimulating hormone or luteinizing hormone of 75 international units each. Recombinant follicular stimulating hormone is more effective but expensive. Injection human chorionic gonadotropin is given for ovulation trigger. Chances of multiple pregnancy of in human menopausal gonadotropin is around 30%, and chances of ovarian hyperstimulatory syndrome is around 5 to 15%. Laparoscopic ovarian drilling. Laparoscopic ovarian drilling can also be done as a second line. Here we burn the stroma of the ovary containing theca cells. By this laparoscopic ovarian drilling, it can never lead to multiple pregnancy, it can never lead to ovarian hyperstimulatory syndrome, but the main drawback here is the ovary can go into premature ovarian failure and pelvic adhesion disease can occur. Third line drug. In third line drug, pulsatile gonadotropin releasing hormone is seen with increased levels of luteinizing hormone, follicle stimulating hormone, and estrogen. Ovarian
thank you and thank you for watching.